Hey guys, it's Anthony Moniz again from Access Health. Remember, I'm the exercise therapist that gives you all those cool tips. Anyway, we got Dr. Bones in the house today. He's going to talk to you a little bit about thoracic immobility. So if you take a look at Mr. Bones here, you can see his rib cage connects right into the sternum. If we flip him around, the ribs wrap around and they meet 12 different vertebrae in the spine. This is called the thoracic spine, mid-back basically. And this whole area is called the thorax. So the thorax contains our organs, it surrounds them, protects them. It also flexes and extends as we take a breath in. It also laterally flexes and extends. So it's got all this movement. We commonly see, however, that this area is very rigid with a lot of our population. The thing that people mostly come in to see us for isn't this area, however. It's the lower back and it's the cervical region. So there's 84 different joint articulations here. So if you were locked up in 84 different spots in your body, what's going to happen? Well, you're going to find a way to get that movement. And it just so happens that those areas are the neck and the lower back. So when we don't move through here, we exert too much movement in problematic areas where we probably already hurt. So what I'm going to show you today is how to mobilize the thoracic spine. We'll get into the full thorax later in different videos, and that'll involve deep diaphragmatic breathing to mobilize the rib cage. But today we're going to talk just about the thoracic spine and how to get all the motions out of it. So flexion, extension, lateral flexion, as well as rotation. So let's jump into it, guys. During this exercise, you're going to slowly roll back and forth on the foam roll on your mid-back from the bottom of the neck to the bottom of the rib cage. Very slow and with deep inhales and exhales. During this exercise, we will side bend your spine around the foam roll. Be careful not to go down too far. Your last rib is free hanging, and this will be painful and can cause injury. Go very slow and controlled. Now that you've freed up motion in your spine, we want to use it. So we want to teach your body how to use that motion. So you're going to do this simple spinal movement, flexing your spine up as you take a breath in and extending as you breathe out. We can do the same type of motion, but with lateral flexion or side bend. You want to take a deep breath in as you come to the side, expand the rib cage, and then slowly exhale and come back to the other side. Should feel some stretching into the lower back and upper rib cage. Last but not least, we want to drive rotation through the thoracic spine. So you're going to step your hip out, that'll open up the hips, and then you're going to pivot your arm around your spine up towards the ceiling and slowly back down with your breath. Okay guys, so persistence is going to be key with this exercise routine. You're going to create motions in your back that haven't occurred for probably years. So give it some time, match it with a routine that's already established. So if you do something at night or in the morning that you always do, match it with that because you know it will happen then. Hope you found this stuff useful and informative, and join us for our next video.